As a new grad, my first job right out of school was in acute care. And when I moved to New York, it was actually my working in a high-end gym that got me thinking more outside the box as far as what was possible in physical therapy.
You're going to encounter challenges, and you need to realize that those challenges are just opportunity for growth and to prove to yourself how hard you've worked.
Find a good mentor. Don't be intimidated by going up and talking to someone. First, you have to know who your ideal patient is, your ideal customer, if you will. When I was kind of mapping out my ideal patient, it went from everything from where do they shop, what do they listen to, what do they read, what are they like, what kind of injuries, how do those injuries affect their life, what would happen if I didn't see them, so you want to create this huge narrative around that person. And then once you have that person, then you can actually start thinking about what kind of practice do you want to build around that patient. So you don't build the practice and hope to bring the patient in. You have the client or the ideal patient in mind, and then you build your practice around that. And that would probably be my first step. And then after that, get a lawyer and get an accountant and get good insurance. Don't do it yourself, because if you do, you're not a lawyer. That would be like saying to somebody going to a lawyer and saying, I really hurt my back, can you fix it?
No.
Who would do that?
You really got to stand out. And coming to conferences, presenting at conferences, because everyone's going to have good grades. Everyone's going to be well recommended. And it's finding someone that, has those feathers in their cap. And I think which may be true across residencies is communication, putting a face to the name. And then putting yourself, if you can, which is the tough thing to do in clinical rotations, is putting yourself in settings that expose you to the area of practice that you want to pursue a residency in.
As a practicing clinician, your patients are now your community, and it's your responsibility to be a good leader within that community. After going to the private practice section meeting, I remember walking around thinking, where are all the ladies? There's just a lot of dudes. And there were no women presenting, there were no women keynotes, it was just very, very male heavy. And I was like, gosh, I know so many women who are business owners and they're killing it. And so then I brought on Sandy Hilton and Erica Mello, and we just put the first one together in 7 weeks. And then
it's grown. It's big now.
Yeah. So, and then this year, I just confirmed a couple of hours ago, but our keynote speaker is going to be Emma Stokes.
Oh, wow.
Who is the president of the World Confederation of Physical Therapy. I think things are changing, and the hope is that the new grads coming up are going to be the ones to really push for that change.
People within this profession see beyond a lot of different identifiers that may be barriers in certain other professions. And what the Women in PT Summit has done to instill that, to encourage women to speak up. What's the book, Lean In?
Lean In, Sheryl Sandberg.
And I think that's important. And and then leaning in a profession that's receptive to that.
I
think that's important.
that's a very good point.
Yeah.